A very good evening. From stories around the world to stories here at home, this is the National News broadcast. I'm Vidushi Sadish Kumar.
Good evening, I'm Clifford Richards. First of all, we take a look at the headlines. Sri Lanka moves out of the red list with the control of the spread of the coronavirus. The PCR laboratory at the ChannelEye International Airport functions successfully. LTT detainees say there is no problem about their security. Sinhalese organization requests to look into alleged malpractices committed by former Health Minister Rajitha Senaratne.
In your local stories this evening, activities of the PCR laboratory established at ChannelEye International Airport commenced last night. It will provide test reports soon, and the persons who are not infected with coronavirus will get the opportunity to move into the society according to health guidelines. Persons arriving in the country can undergo PCR tests within 3 hours. 53 who have arrived from Dubai was sent first for PCR tests. Minister Prasanna Ranathunga and a group were present to observe the situation. Any person arriving in the country can undergo for PCR test for $40 from the laboratory. If it is confirmed that they are not infected, they will be able to travel to their homes and to tour the country. 25,961,797 have been given a vaccine dose under the COVID vaccination program. 14,367,807 have been given one dose of a vaccine. 11,593,990 have been given both doses of a vaccine. 1,155,134 vaccine doses have been given during the last 7 days. 148,306 vaccine doses have been given yesterday. Children between the ages of 12 and 19 with special needs, chronic illnesses and complications are being given the Pfizer vaccine. It is taking place in Colombo, Kurunegala and Anuradhapura districts. Vaccines were given at Lady Ridgeway Children's Hospital in Colombo today as well. Vaccination of children with special needs and chronic illnesses are taking place in the Kurunegala district. It is taking place at Kurunegala General Hospital, Nikavarattiya Teaching Hospital, Galgamuwa, Kuliyapitiya and Dambadiniya base hospitals. Vaccination of persons between the ages of 20 and 29 are taking place in many districts. Youth at 5 Gramanildara divisions under Bhagawanthala Medical Officers area took place today at Bhagawanthala St. Mary's National School. Vaccination of persons above 20 years is taking place at 14 areas under Medical Officers area of the Batticaloa district. Persons between the ages of 20 and 29 can get the first dose of the vaccine, while the others can get the second dose at those centers. Sri Lanka Army is continuing to give COVID vaccines to persons more than 20 years at Battaramulla, Diyatha premises. Vaccines are given to persons more than 60 years and with special needs. Vaccines were given today for individuals who cannot leave their homes in Kurunegala, Mallavapitiya Medical Officers area. 747 COVID patients were found from the country today. 46,066 are undergoing treatment. 843 have recovered from the virus. Accordingly, 454,532 have recovered from the coronavirus. The Director General of Health Services confirmed today 71 COVID-related deaths which occurred yesterday. 56 out of them are 60 years and above 60 years. 14 are between ages of 30 and 59 and one person is below 30 years. COVID-19 treatment center established at Kandy General Hospital was opened today under the patronage of Minister Keheliya Rambukwella. It is equipped with 16 intensive care unit beds. Philanthropists in the area have assisted to build the center. Sri Lanka Army has provided the labor. Minister Keheliya Rambukwella visited Navalapita District Hospital yesterday to look into its future development activities. He held a discussion with the hospital director and the staff. A group of people, including Minister Mahindananda Alutgamage and Director General of Health Services, Dr. Asela Gunawardana, were present on the occasion. A music program named Suavirugi Miasia was held for COVID-19 patients and staff at Ingiriya Hospital. National Youth Services Council is implementing Be Happy with Youth program series for the mental well-being of people living in high-rise housing complexes and their environs. One such program was held yesterday at Moratuwa Soisapura Housing Complex.
And now for the COVID situation down under in Australia. Australia's two most populous states, that's Victoria and New South Wales, have been struggling to contain the highly infectious variant while they ramp up vaccinations to 80% of the population, a threshold to allow officials to ease strict lockdown measures. The state of New South Wales has recorded 961 new cases in the last 24 hours, while Victoria State has logged 779 new infections. New South Wales recorded 288 deaths in the Delta outbreak accordingly for nearly a quarter of the country's approximately 1,230 deaths. Amidst a slight increase in new cases, some Victorian restrictions will ease this week, while New South Wales have announced new freedoms for both vaccinated and unvaccinated people. Meanwhile, Australian Prime Minister Scott Morrison has requested state leaders to make preparations to reopen the states once they meet the vaccination targets. 3/4 of Australians have had their first dose of the vaccine, while close to half have had both doses. Meanwhile, UK researchers have been examining MRI scans to identify long-term damage of the virus to internal organs. The study has been carried out by the medical innovations company based in Oxford, who examined 550 patients with no pre-existing conditions before their COVID-19 infection. Research has found 70% of the patients had impairment to at least one organ. A third had damage to at least two organs, and heart damage was found in 17% of the group.
Chairman of the Public Services United Nurses Union, Venerable Muruthetwe Anandathera, says that they will not join the trade union action scheduled to be launched by several health sector trade unions. He said that they believe the budget will provide solutions to their demands. Venerable Muruthetwe Anandathera said that it is an inconvenience to the patients if hospital and health staff conducts strikes often. They should make demands and win their demands, but should also think about the people. The present pandemic situation should be considered and action should be taken accordingly. Staff of the Public Services United Trade Union will be committed for the service. There are more demands to be won, although 7 had been won. He said they believed that the remaining demands can be won after the budget.
Justice Minister Ali Sabri says that LTT detainees say that there is no problem related to investigations on the Anuradhapura prison incident and security. He mentioned this to media following an inspection tour of the prison. Well, the minister made the inspection tour to look into the shortcomings of the prison and to provide necessary facilities. A group of people, including Minister S.M. Chandrasena and State Minister Shahan Semasinghe, were present on the occasion. Justice Minister Ali Sabri said that there is an idea to take Anuradhapura prison system to Oyamadu area, where there are 125 acres. There are several LTT prisoners at the premises. After discussions between a group of opposition parliamentarians and Tamil United Liberation Front members who said that there is an issue about security, it should be taken to another place. However, the minister said he clearly stated that there was no problem related to security and other facilities. Although certain people politicized it, the prisoners said there is no issue about security. They have met the Human Rights Commission and Tamil National Alliance parliamentarians, but their views have not been influenced. Minister Namal Rajapaksa had also said to disclose what they took place without any influences. They said that there was no racism.
Sinhalese organisation says that a separate committee should be appointed to look into malpractices committed by Minister Rajit Sena when he was the health minister. Meanwhile, several people expressed their views about the malpractice which had taken place when purchasing a building at Bulat Sinhala area, spending 90 million rupees from the State Pharmaceuticals Manufacturing Corporation. State Minister Jayantha Samaravira inspected the building yesterday. State Minister Jayantha Samaravira said that they can reveal evidence about a crime committed by misusing funds of the State Pharmaceuticals Manufacturing Corporation. The Gasari private hospital, built about 8 years ago, is situated in the centre of Agal-Oya town. The owner is a person called Manjula Ranawaka, who is a cousin of a former political authority. This Manjula Ranawaka became a coordinating secretary of Rajit Sena. Manjula could not maintain the hospital and the bank took over it since he could not pay the loan. Former Minister Rajit Sena used funds from the State Pharmaceuticals Manufacturing Corporation to purchase the hospital for 90 million rupees while giving the ownership to Manjula. This is a misuse and a wastage of public funds.
Well, a letter said to be sent by the Western Province Intelligence Division is being published over social media. Well, although the letter is forwarded by the Director of the Intelligence Division, police headquarters say the information on the WhatsApp group mentioned in the letter is false. Well, it is a punishable offence under the criminal law to publish such information either over social media or any other manner. Therefore, the police headquarters has requested the public to refrain from publishing such false information over social media or in another manner. Police Intelligence Unit gather intelligence information which could be considered as a threat to national security and analyze them. When necessary, those information is sent to the relevant officials. The police headquarters said that receiving such information or reporting it does not confirm it taking place. It is a punishable offence under the State Secret Act to disclose documents that has reported secret information of the intelligence units. Meanwhile, publishing information that can endanger public security is a punishable offence under the Computer Crimes Act.
Sukhi Degayu program, which aims for a healthy life with indigenous medicine, commenced this morning at Nugasavana Vedagadara premises of the National Television. The program is scheduled to be telecast every Friday from the 8th of next month over Nugasavana program. The program was launched on a concept of Chairman of Sri Lanka Rupavahini Corporation, Reginald Curray. The program expects to secure the future of indigenous medicine and supporting the control of the pandemic. A large number of indigenous doctors as well as indigenous medical organizations have joined the program.
දේශීය වෙදකමේ තියෙන වටිනාකම අපේ හදවත්වල විතරයි තියෙන්නේ. ඒවා ප්‍රකාශනයේ ඉතාම අඩුයි. අත්විඳිනවා පමණයි මිහිර විඳිනවා.
State Minister Sisira Jayakodi said that a website called Ape Veda Mahattaya was launched recently to identify authentic indigenous doctors and to introduce methods such as e-channeling services. The website includes 24,000 indigenous doctors, but there was no publicity for the site. Only Rupavahini Corporation gave publicity to highlight the national heritage.
වෙබ් අඩවිය නිර්මාණය කර මේ තොරතුරු සියල්ල අපි එළි දැක්වුවා. ඇත්තටම ඒ වෙලාවේ අපි කියන්න ඕනේ එදා දවසේ විශේෂ සිද්ධි දෙකක් වුණා. එකක් තමයි වෘත්තීය සමිති නායකයෙක්ව නිරෝධායනයට යැවීම පිළිබඳ සිද්ධියක්. ඒක විනාඩි දෙකෙන් දෙකට පහට බ්‍රේකින් නිවුස් ගියා. හැබැයි මෙච්චර මහාසාර දැනුමක් තියෙන අපේ වෛද්‍යවරු 20000ක් එකතු කරලා හදපු වෙබ් අඩවිය ගැන ප්‍රකාශයක් කළේ ජාතික රූපවාහිනිය විතරයි. මේ උරුමය මතු කරගන්න කරන උදව්වට අපි නැවතත් ඉන්නවා.
අද මේ කොවිඩ් වසංගතය මර්ධනය කිරීම සඳහා
Chairman of the Sri Lanka Rupavahini Corporation, Reginald Curray, said that indigenous medicine system and the Ayurveda system are contributing immensely to control the COVID pandemic and to accelerate immunization process. Suki Digayu program was launched to introduce qualities in the indigenous medicine for today and to hand over it to the future. The program expects to publicize the methods of local medical system all over the world.
ඒ විතරක් නෙවෙයි මේ නිධානය වහගෙන ඉන්න බහිරවයාගෙන් මුදාගෙන ඒ වෙදකමේ හාස්කම ලොවට පතුරවන්නටයි සුඛී දීඝායු පටන් ගත්තා.
අපේ පොඩි කාලේ
Director General of the Sri Lanka Rupavahini Corporation, Jayanpathi Bandaraheenkenda, said that this is the best time to introduce indigenous medical systems to the world and to include it to tourism industry. This is also the best time to encourage the local medical system. The program would pay the attention to the contribution of indigenous medicine for various illnesses. Well, with that, stay tuned for more local stories coming up next.
Unite together to keep us safe, a healthy nation for you and me.
Our lives, our responsibility. Let us help to eliminate dengue.
Prima Stella Set Yogurt. Be healthy, be active and be safe.
Our lives, our responsibility. Let us help to eliminate dengue.
Welcome back to the news, and we continue with more local stories. Well, the 62nd commemoration of the founder of the Sri Lanka Freedom Party and former Prime Minister SWRD Bandaranaike falls today. A special ceremony organized in connection with the anniversary took place near the Horogolla Bandaranaike Samadhi today. Well, the ceremony has been organized under the patronage of former President Chandrika Bandaranaike Kumaratunga. A group of people including Sunetra Bandaranaike and relatives of the family attended the ceremony. The 21st commemoration of late Prime Minister Sirimao Bandaranaike and the 13th commemoration of Mr. Anura Bandaranaike were also held on the occasion. Sri Lanka Freedom Party was established by the late SWRD Bandaranaike together with 5 forces of Buddhist monks, indigenous doctors, teachers, farmers and the workers. The late Prime Minister Bandaranaike, who introduced many people's-friendly measures, was assassinated by a gunman on the 26th of September 1959.
Minister Prasanna Ranatunga says that the country should be opened on behalf of about 3 million persons engaged in the tourism industry. The minister said that it will be implemented according to the advice of health authorities. Minister Prasanna Ranatunga said that nearly 400 have been sent for PCR tests last night. There is a good response from the tourists and Sri Lankan emigrant workers. There are about 3 million people making a living out of the tourism industry. Problems cannot be solved only by giving concessions without uplifting the industry. Other countries are opening for tourists while following certain methodologies. He said attention should be paid to bring down tourists by following those methods on behalf of the people working in the industry. Measures will be taken by holding discussions with health authorities.
52,000 farmers in the Polonnaruwa district have applied for the 12,500 rupee allowance by the government to produce organic fertilizer. District Secretary W.A. Dharmasiri said 7,500 rupees have been paid as the first installment for 10,000 farmers. Well, the production of organic fertilizer needed for the Maha season in the Polonnaruwa district has commenced together with the farmers, state and private institutions. 720,000 hectares are expected to be cultivated with paddy and 4,500 hectares are expected to be cultivated with additional crops in the Maha season. 36,000 metric tons of organic fertilizer is needed for paddy cultivation and 9,000 metric tons needed for other crops. More than 45,000 metric tons of fertilizer is needed in the Polonnaruwa district for the Maha season. The program to produce organic fertilizer is being successfully implemented. Evaluation and recognizing of 10 best home gardens out of 201 organic home gardens in Nachadu Divisional Secretariat area took place recently. The organic home garden of Mr. S.K. Renis won the first place. Providing loans on concessionary interest rates for organic fertilizer producers at Thangalla Beliyatha Mulkirigala seats took place under the patronage of Minister Namal Rajapaksa at the Thangalla Vanavasa Kuda Vihare. Loans from 1 million rupees to 50 million rupees are being given for this purpose.
Minister Namal Rajapaksa inspected the progress of the housing project which is being built in Anuradhapura town from middle income earners. 135 houses are being built at the place. 1,600 million rupees are being spent for the project, which is expected to be completed in October next year. A group of people, including State Minister Shahan Singha and Parliamentarian KPS Kumarasiri, were present on the occasion. A program to plant saplings by the sides of the roads in the Kegaul town commenced yesterday in Rambukana under the patronage of State Minister Kanaka Herath. The development project from Anuradhapura Court roundabout to Provincial Council roundabout on Dharmapala Mawata commenced yesterday under the patronage of State Minister Shahan Singha. The program is implemented at a cost of 18.5 million rupees. The development of the road from Kegaul Puakdinya Dispensary to Nilwaka commenced today under the patronage of State Minister Taraka Balasurya. 27.9 million rupees will be spent on the project.
Well, it's time to end the news. Do enjoy the rest of the programs. Take care. Good night and stay safe.
Good night.